Good morning, the AIOS family. Greetings from Disha. It's become a fashion today to have chain hospitals, and 3 new hospitals have started near us. A charity hospital for good treatment of the poor, a posh business hospital obviously for business, and a group practice hospital of 3 young doctor friends. Which one would you give most value? I hope it should be the third. And our patients, well, they don't want their gods to compete, but they want them to co-create together. The solo practitioner starts a small clinic. He invests time in a charity, polishing his skills, works day and night to create value. His small practices flourishes by his hard work. Happy patients refer more patients. He puts in an animal effort to justify and to serve that value individually. Till one day he says, enough is enough, and he draws the line. He raises his charges, and his old loyal patients feel probably that he's become money-minded. He invests in equipment which is beyond individual justification. He employs doctors who feel it is not theirs. So he actually undoes all the value that he has so dearly created over such a lot of hard work. Patients pay us, they don't buy us. They feel they have paid off their fees, but not for our hard work, the personal ministration that we give them. To repay that, they send us patients, they bring us gifts. This is value, and I think this value is too precious to let go once we turn old. So the value has to propagate and compound with time even beyond us. And I understand group practice gives us a very good module to do that. The petals may be too charming, but the seeds are perhaps more important. Group practice does very well in the US. It is a defined concept. The US medical system is a competitive marketplace, systems, protocols, finance, and insurance, but yet too, corporate exercises don't do very well there. It's mainly group practices because doctors are regarded as the prime movers of healthcare, even in cosmopolitan, venture-prone US. There are practice managers who draft partnership agreements between participating members based on goodwill money, calculated over a period of time, contribution of each member, sweat equity, profit sharing, and a member can actually buy in or pay out of a practice. It is so systematically drafted. And this is preserved by the federal law, which is prompt and efficient in its action. But in India, unfortunately, the law is that there is no law. And we are not very frank and transparent so far as money is concerned. So what is the case of group practice in India? Even if we take a look at the Indian scenario, the biggest practices and the best practices in India are group practices. Whether it is the Nagpals in the west, or the Sharafs in the north, or maybe us in the east, it's group practice. You may say it's family practice. So what is there in family that doesn't exist between 2 practicing individuals? Faith. And this is very important because we give knowing that we will get, we have that faith. Now the other 2 models which have done so well and so good for us, Shankar Nethralaya and LVPI, they are not group practices. Well, this brings us to another aspect, very good aspect of group practice, and that's doctors' governance, where every decision is being taken with patients in mind and not profits. Well, how does an ordinary doctor earn faith of his peers? A simple word, sacrifice for a cause. And it should have an offering advantage and not to just vend competition and a conviction to the cause. Sacrifice isn't a big word with big connotations. It merely means to give your immediate position of strength for a more efficient future. The group always goes with the leader, and the leader preferably should be the senior most, has the most to give, and he should be the change agent. The other members of the group should better complement each other. If someone brings finance, the other brings enterprise. If someone brings cataracts skills, the other brings retinal skills. Well, young doctors can start group practice hospitals in suburban location because I understand that's the growing part of India, and in a very flexible format and a very transparent format, a private limited company. Faith and sacrifice is a natural ingredient in an unpolluted young age. They can work 3 days in the city and 3 days in a suburban hospital to take care of lifestyle needs. BBI Foundation in Kolkata, the Visitek model in Delhi, the ASG hospitals in Rajasthan, there's so many young group practices between friends from the same medical college doing very well. So they are good examples to follow. And the value can propagate by having a second hospital following the drainage of the first to facilitate the new doctors. The sweat equity of the new doctors can be converted over a period of time when the whole exercise is ironed out into equities on a 49-51%. And even we established doctors can think of starting a new hospital on a similar. So growth is a natural order till adulthood. And if we don't change, we have to reproduce with responsibility. We have to get married and we have to have children because we need grandchildren. One day we have to retire and then we'll become children again. And this relationship between a grandparent and his grandchild is perhaps the best marriage of the social order. One has the experience of the past and the other the promises of the future. So group practice is a human affiliation in India and we need to carry it forward. Thank you for your attention.